Yeah, let me just briefly introduce myself. Yeah, so my name is Manuela. I'm doing a dual PhD, so I'm here in Groningen at the RUK, but also at the university in Passau in Germany. But I just came back to Groningen actually yesterday, so I will be the next half year. I'll be here in Groningen.
Very good.
Then let me continue. So I just need to check. So now you should be able to see my screen. Is that right?
Yes, correct.
Okay.
We can see you.
Perfect. Great. Then thanks for giving me the opportunity to present my research, which is entitled Climate Change and Non-Communicable Diseases, Health Challenges of the 21st Century. Climate change will pose a detrimental threat to decent health in the forthcoming decades. The Lancet, one of the most prestigious academic journals, even considers climate change as the biggest human public health crisis. And this was even during the time of COVID-19. Hence, we have a code red when it comes to how climate change will affect human health in the 21st century. However, not all countries will be equally affected by the consequences of climate change. In fact, those countries that contribute the least to CO2 emissions and climate change will be the most severely affected. Especially low and middle income countries are prone to be overwhelmed by the consequences. And one of the regions that will be heavily affected is Southeast Asia, as you can see here on the map, where the darker red tones indicate a higher ranking in the climate risk index. Yet when we look at the distribution of research on the health effect of climate change, we know surprisingly little about the most severely affected countries. As you can see here on the map of the global distribution of research on the health effects of climate change, most research comes actually from the US and Europe, but little evidence exists for the remaining part of the world, especially for low and middle income countries. And this is exactly where my research sets in. I explore the health effects of climate change, to be precise, of increasing temperatures, in the context of Southeast Asia and especially in Indonesia. And here you might wonder why I then address chronic non-communicable diseases and not infectious or transmittable diseases, which are commonly thought to cause the major health burden in low and middle income countries. Well, the fact is that more than 70% of all deaths in the Southeast Asian region are nowadays attributed to non-communicable diseases. The three leading causes of death in Indonesia are stroke, heart disease, and diabetes. Hence, assessing the interplay here between climate change and NCDs in the region is of foremost important and urgently needed. And especially since the prevalence rate of NCDs are still on the rise, but local health facilities are not adequately designed to address the rise, since they still focus to a large extent on combating infectious diseases. I try to assess exactly this link, and I do so by using a nationally representative data set of 1.7 million individuals that are covered by the newly established Universal Health Insurance Scheme, JKN, in Indonesia. And with that, I assess the causal link between high temperatures and NCD-specific visits at the primary healthcare level, controlling for other factors, of course, that might bias the results. And in Indonesia, the primary healthcare level consists of so-called community clinics, which are called puskesmas, and which you can see here on the right-hand side on the two pictures. And in the quantitative data that I use, I do find causal evidence that on a day with a mean temperature above 30 degrees, the number of patients seeking care at the puskesmas increases by 8% for all cause visits. But when we differentiate by course, it even increases for 23% for diabetes and 14% for cardiovascular diseases such as stroke. I also assess the effect on chronic respiratory diseases, but here I do not find any effect. Yet the evidence that I get so far relies only on quantitative data, but I want to dig deeper and enrich the quantitative data with qualitative data from the field to respond to the still unanswered questions, such as how can local facilities respond to the surge in visit rates and how resilient are they? Moreover, I also want to investigate the capacities the local health centers might have or not have to interact with individuals at risk or meteorological services. And this is also what I will use this grant for. I will spend it on field research in West Java to collect supporting qualitative data from interviews and focus group discussions. And thereby I hope to be able to investigate the capacities and limitations of the primary healthcare facilities in the light of adverse health effects that might be caused by extreme temperatures. And moreover, I aim to derive relevant policy recommendations on feasible and cost-effective solutions and explore whether the findings that I have hitherto are also externally valid for other countries in a similar context. Thank you.